Hello and welcome to the Updox Amazing Charts webinar, your one-stop shop for convenient document management and virtual care. Welcome, everyone. Thank you, everyone, for joining today. Welcome to the one-stop shop for convenient document management and virtual care webinar presented by Updox. Thank you, everyone, for joining us today. We'll be going over our webinar's theme today in reviewing electronic faxing as well as telehealth today. Let me introduce myself. I am Matt Swider. I'm the senior channel manager of partnerships at Updox and your host for today's webinar. I have worked at Updox for the past 4 years and currently sit on the business development team. I'm passionate about helping out practices leverage technology to make their patients' care better, and I look forward to presenting today. All right, well, let's get moving. So what you'll learn. In today's webinar, we're going to equip you with essential knowledge and tools in 2 crucial areas for your practice: document management and virtual care. What you can expect to learn today is how we can streamline documents and document workflows to make your office run smoother, make processes cleaner, more efficient, and give you time back in your day, as well as virtual care and how you can use simple telehealth solutions to bring care to your patients and provide other options for your patients to contact your practice. Where do our day-to-day challenges come from? A lot of them come from our operations. Administrative duties, office processes can slow down our office, steal time away from our patients and our staff that we can be giving our patients better care. Operational challenges in healthcare are multifaceted and can come from a number of different ways. Resource allocation, staffing shortages, patient flow, medical errors, right? All of these things will slow down our practice, and we want to eliminate those as much as possible. So what Updox will try to do is try to streamline these processes to give staff more time back in their day and help them engage with their patients more. When we think about what our staff is doing and how much time we're charting, for every patient that we see, there's 1 to 2 hours of paperwork. What we want to make sure is that 1 to 2 hours is being used as efficiently as possible. We don't want to have a back and forth from provider to staff to provider to another practice. We want to have a streamlined, consistent workflow and make it as efficient as possible. You think about the challenges that we're having, what are causing these challenges and how are they affecting our practice? When we think about our practice, if we're using something like a paper fax machine, there could be many steps in this process. For an inbound fax to come in, be assigned to a specific person, for that document to be signed, scanned back into the computer, and then sent into the patient's chart, and then we have to shred that paper at the end. So a lot of what you're seeing on the screen here are just hard office supply costs when we see paper around the office. What Updox wants to do is eliminate paper around the office, whether it's in faxing, patient communication, electronic forms, anywhere Updox can take paper out of your office, we're going to try to do that. And we know that, statistically, for a misfiled document, there's about $120 worth of labor that goes into that effort. And for a recreation of a document, it's about $220. So we want to make sure that we can save time, we can limit the mistakes that we're running into, and give time back to our staff. This stat we're seeing on the screen here, 90% of patients no longer feel obligated to stay with a provider that can't offer a satisfactory digital experience. According to a 2019 survey, the major factor for people looking for a provider is an online review. They will go online, they will look to see what services you offer, how accessible you are digitally, and make a decision based on that. If we're not keeping up with the technology, we're going to be behind the times. We need to make sure that we're moving forward and keeping our practice up to date. So how can Updox do this? How can we help you guys stay up to date? How can we give time back in your day to your patients and provide better care to your patients, all with communicating in a streamlined fashion as well? So when we're purchasing technologies for our practice, we need to make some considerations on how it's going to impact not only our staff, but our patients as well. We did a survey where 60% of respondents rely on 4 or more different technologies in their office. And what Updox will try to do is take those technologies that might be using multiple logins, bring them into a single point solution that will integrate with AmazingCharts. So as information, whether it's patient communication or documents, come into Updox, we can safely send those into the EHR with just a few clicks. It doesn't help that technology has traditionally been behind the times for communicating with patients and providers. What we need to do is make sure that we're staying up to date with the technologies and giving our patients access to us and our staff as openly and as easily as possible. Patient satisfaction is directly correlated to the amount of face-to-face interaction with physicians. Physicians, on average, spend only 1 to 1.5 minutes of direct face time with patients per visit. If you think about the last time that you went into a provider's office, they may turn to you to ask you a question, but they're doing a lot of the charting and documenting, looking at their computer, and then moving that document through its workflow post-appointment. So how much time are we spending? How much cost is going into our operations? If we're running our practice, 73% of our revenue is going towards the operations of the practice. Let's make sure that our practice is running like a well-oiled machine. And again, Updox bringing multiple systems into a single point solution. You shouldn't have to have a system for texting with your patients, for telehealth, for digital forms, for appointment reminders. What we want to do is bring those into a single point solution that will connect with AmazingCharts. And what we do is by condensing those solutions into a single point solution, we give your staff time, and it's much more easily accessible for your staff. They have the ability to jump from their inbox, to communicate with their patients, to chart, to send documents into the chart. They have a number of different ways and tools available to them at their fingertips, and have the integration to push communication and documents into the Updox inbox. And what Updox wants to provide is a simple solution, a simple connected technology with integration to AmazingCharts that's not hard to use for your staff to easily communicate with each other and their patients and streamline inefficient manual tasks. By centralizing communication with patients and providers into one inbox, AmazingCharts primary care practices can leverage Updox to save time and costs associated with manual processes and disjointed technology workflows. Updox looks to improve patient engagement, increase office productivity, and streamline patient and provider communications all in a single point solution. On a high-level overview, Updox is easy, patient-friendly, staff-friendly. We can manage communications with providers, pharmacists, and patients integrated with AmazingCharts. 33% of providers say Updox saved them 1 to 5 hours a week. For this next portion of the demo, we're going to be jumping into the Updox inbox, and I'm going to be showing you a simple inbound and outbound fax workflow and how we can manage those faxes coming into the practice and then sending them out. So I'm going to go ahead and just stop my share here. And I'm going to go ahead and jump into the Updox inbox. So we jumped into the Updox inbox, and you can see here we have 4 fax pages from a number, so we can see what number that fax came from. If I open this up, I can quickly hover over the fax to see the fax page as well as what other information is on this page. So it looks like we have some tests that have just come in. Now, as a document comes into the Updox inbox, there's a few things that we can do. The first thing is a tag. So we can have this fax tagged to a specific user, to a specific workflow if we need to. So if it comes in and we need to tag it to Dr. Mason, we can actually tag it to that user. And each user can go in and determine what tags that they need to have highlighted based off of how the office workflows are set up. So when a fax comes in, I can quickly take a look at the fax. If I double click in, I can add text. So if I need to add some text, I can do that. I can bold, I can highlight, I can freehand draw if I need to do an initial. I can also do a date and timestamp, right, with a signature. Once I make the edits on this page, they're going to be permanent on this page. Now, as these documents come in, I can fax them back. So if I click on fax back, it's just going to say replying to your fax. It'll typically give us the default cover sheet. And if we hit send, it'll be going back to the number that it came from. However, we have also another option. If we hit send item up here, we can type in the patient's name. We can see their chart, their date of birth. And now we would have the option to send this to the EHR. So if we send this into the EHR, it's going to go in the imported documents section inside of AmazingCharts. So as this document comes in, we can also, through our advanced fax routing settings, we can have faxes that are coming in from a specific number be routed and tagged to a specific queue, a specific department, and have a specific tag associated with it as well. So if we're thinking about an inbound fax, maybe coming from an insurance company, we can have it tagged, we can have it set to the billing department, and we can have that routed to the correct user. So as these faxes come in, again, if we need to fax them out, we can select the pages that we need, fax back, and hit send. Those faxes are now sent out, are on their way, and we can see in the sent folder, if we look at the newest first, that fax is on its way. And we'll get a confirmation. Once that fax is delivered, we'll have a confirmation page that'll be generated once the fax hits its destination. We also have a couple other abilities with the Updox inbox. We have the ability to drag and drop documents. So if I need to take a document from my desktop, I can quickly take a folder, or I can quickly take a document and drop it in. And that will be uploaded into the Updox inbox. From here, we can take this uploaded item, we can attach it to a fax, and we can send it off to a patient's chart, or we can send it as a fax to another office. So as the upload comes in, we can grab pages from down here. We can attach those to a fax up here. And now we can send all 6 pages out to another office if we need to. And that is a simple inbound faxing workflow for a fax to come in, be tagged, be assigned, be faxed out, or sent to the patient's chart. And we've jumped into the Updox inbox. So from here, we can see that we have an inbound fax here. It looks like we've got 11 pages that have come in from a specific number. So as we hover over, we can see the cover page. And if I double click in, I have the ability to add text if I need to. I can bold, italics, I can freehand draw for an initial if I need to. I have a highlighter. I also have the ability to add a signature, date, and timestamp. So if I need to, I can go ahead and sign on to a document. Now, any of the edits that I make to this document are going to be permanent. So once I save this document, you can see that the signatures are back on there at the bottom. And now what I can do is I can tag this document to go to a specific user. So if this needs to go to the billing department, I can go ahead and notify the billing department, and I can also leave a comment. This payment is ready to process. Right. And now as that user in the billing space, we would only have the tags that would apply to us, and I would only see the billing. And now I could move that note, if it was completed, back to, Dr. Barron, or I could remove that tag altogether. And if I refresh that, that would be out of the billing view. So very easy way for a document to come in, to see who it's coming from, to see what time it came in. And now, once this document comes in, there's a few different options that we have. So the first one is faxing back. So this will simply reply back to where the number came from. We can send a cover sheet also if you need to. And all we do is hit send, and it'll go right back to where it came from. If we need to, we can add more contacts over here. So we can add up to 4 different destinations that this fax can be sent to. So we're not going to go ahead and send this one out, but we are going to go ahead and send this item. And when we send the item, we can do it in a number of different ways and to different people. So one, we can send this into the EHR. So as we send this into the EHR, we have the ability to drop this and notify the doctor. We can also add this to for an outbound fax as well. So if we need to set up another fax number, we can do it up here and we can add that to the destination. But these documents down here below are going to be sent to the EHR. And again, if we do need to add those to another destination, we can in this column. So once we hit send item, these documents in here would go right into AmazingCharts. So a really easy way for your documents to come into this Updox inbox, to be managed, to be assigned, to be marked up. And then once they're ready, we just select those pages that we need, and then we send them directly into the patient's chart. Send to EHR, okay. And we go ahead and send those directly into the patient's chart. Additionally, when faxes come into Updox, we can have rules set up through our advanced fax routing solution. So numbers from a specific number can be routed to another number or a different queue and be assigned a tag. So as faxes are coming from the insurance company, from the pharmacy, from different offices, we can have those be routed to the correct user and to the correct queue inside of the Updox inbox. So thank you everybody for the brief faxing demonstration. And now we're going to be talking about telehealth and video chat. And if you haven't adopted video chat through COVID, I would say that a lot of patients, 77%, are willing to try this. It's something that now it's not going away, and it's something that we need to be adding to our practices. According to a Harris poll that was connected online, of adults 18 and older, 42% of Americans have tried telehealth and are going to continue to use this as a source of communication with their practice going forward. However, telehealth years ago, before the pandemic, was something that was a new technology that would be a large undertaking for a practice to get up and running. The COVID pandemic really set telehealth into high gear, and it is very, very easy to get started with a telehealth solution in your practice today. Is it HIPAA compliant, your telehealth solution? Is it easy to use? How are your patients with technology? Are we going to be asking too much of them if they have to download an app from the Apple iTunes iStore or the Google Play Store? We need to think about how we're going to be using this as a tool, how we're going to be setting this up as a service, and if our staff is able to take advantage of this as a new source of communication and care for their patients. Patients who use telehealth services, 65% say it's because telehealth visits are more convenient than in-office appointments. And 63% say it's because they don't want to be exposed to sick patients. So you can see that there's a very good use case for telehealth. We can use these for quick sick visits. We can use these for ways to follow up on patients to see if we're continuing to care for them. Telehealth is a great solution that can be used outside of the primary use it was made for. So how are you using telehealth at your practice today? Does your telehealth solution allow you to manage multiple patients? Do you have a waiting room? Do you have a public URL that you can send out automatically to your patients? How are your patients being invited? These are some of the things that you need to think about how to use telehealth, how easy it is for your staff to use, how easy it is for your patients to use. And Updox, through the pandemic, got Best in Class awards, Consumer Health and Human Services recommendations, and Consumer Reports as a top telehealth solution. And we're continuing to improve our product. So right now, what I'm going to do is go ahead and jump into the video chat workflow to show you a quick video on how easy this is. So we've jumped back into the Updox inbox to launch a video chat session. So from here, we can go up to the video chat button and go ahead and click on that. Now, once we click that button, we're going to be landing on our invitation page. So in our invitation page, there's a couple different things I'm going to go over with you. I do want to start with the settings area, because in the settings area, this is just kind of some of the features that the video chat solution does provide. So we do have virtual backgrounds if we need to have a nice background or blur out our background behind us. We can have a specific display name, Dr. Swider, Dr. Lashy if we need to. We can also set public URLs or unique URLs. So if I wanted to, make this URL urgent care calls, right? I can go ahead and save a waiting room to be set for urgent care calls. So different ways to use this throughout how it's been typically used over the past few years, but people are getting very unique and creative in ways that they use this public URL. Also in the waiting room, we can have a greeting message as well as have your name displayed, whether it's a care team, a provider, or a member of your staff. And we can also grant access to different waiting rooms. So if we need to have patients being welcomed or maybe some vitals being checked by the nurse prior to the provider, we can have other people access that waiting room. So I am going to jump back into the invitation screen here. And what I am going to do is hit send invitations, and I will type in the patient's name here. So if I just type in the patient's name, you can see there's their contact information. Now that will pull from AmazingCharts. If they are not in the in AmazingCharts or in Updox, you can type in their phone number. So here's my cell phone number. There I am as the patient, and I'm going to go ahead and send a text message, and I'm going to send an invitation to myself to start this. So on the patient's cell phone, they're going to be getting a text message that says, at the time of this call, please join a secure video chat by clicking this link. So as I click the link, as the patient clicks it, it's going to run a diagnostics check on their phone to make sure that their microphone is turned on, that their camera is turned on, and their phone is up to date. And once they've joined into the session, we can go ahead and start the video chat session. And you'll go ahead and see the provider and the patient. And I would be able to take notes on this without the patient seeing. So the patient's not seeing on my screen right now. I also have the ability to take pictures. So there's a few pictures of the patient. And I can also share my screen. So if I wanted to share my screen with the patients to review with them any lab results or x-rays, I could absolutely do that. I could also send them back into the waiting room to have another provider or another member of the staff scoop them up. For the purpose of the webinar, I'm just going to go ahead and end on this. And this is the summary that's going to be created, right? So we can see the summary, and I'm going to go ahead and send that summary to the Updox inbox. Now, if we go back and we look at our inbox, we can see the video chat summary that was created. There's the summary, the pictures, and now we can send that item into the patient's chart. Send to EHR, okay. And now we can just send it in. All you do is hit send, and that's going to drop in the imported items section of the EHR. And that is a very simple high-level view of our Updox video chat. So folks, thank you for your time today. We just want to make sure that you guys know that there are AmazingCharts and Updox customers out there that are excited to be using us and see value in using us. Dr. James Legan is one of them. And Updox does offer multiple solutions, like I said, in a single point solution. So as you're looking at probably competitors of ours, think of Updox and know that we can bring all of what our competitors do into one place. So in closing, implementing and adopting the right technology for your practice can make all the difference. Enable your patients in their healthcare journey and give your staff the tools they need while making it easy for them and your patients to communicate. Thank you all for joining the webinar today. This recording will be available on the Amazing Charts website. And if you have any questions, please reach out. Thanks, everybody.